Good morning, students. Today we will discuss about the topic antibiotic sensitivity testing. So this is a test which is done in microbiology laboratory. This test is very important because it tells us about the antibiotic, its role, and whether it is able to kill that particular bacteria or not. So the purpose of antibiotic sensitivity testing is it is an in vitro testing, means it is done in laboratory. It is a test which is done by doing the bacterial culture, and this bacterial culture is then tested with particular antibiotic or a group of antibiotics to determine whether it is susceptible or resistance. It means whether the bacteria is being killed by the antibiotic or not. It is performed only for pathogenic bacteria isolated from the specimen and not from commensal bacteria. Means it is performed only for the bacteria which can cause the disease in the human and not for commensal bacteria. Commensal bacteria, as we all know, are the bacteria that are useful to humans. For example, E. coli from urine is subjected to AST because we all know that UTI is caused by E. coli. So, when E. coli is isolated from urine, it is subjected for AST. And when same E. coli is isolated from stool, it is commensal and AST is thus not performed. So, we will discuss about the first method, that is disk diffusion method. This diffusion method, first is Kirby-Boer's disk diffusion method. They are suitable for rapidly growing pathogenic bacteria because Kirby-Boer disk diffusion method is very easy to perform. So it is mostly done in all the laboratories of medical colleges and hospitals. So, Kirby-Boer's disk diffusion method are suitable for rapidly growing bacteria because in 18 to 24 hours of incubation period, we will get the result. Here, the antibiotic allowed to diffuse through a solid media so that the concentration is highest near the site of application of the antibiotic disc and decrease with the distance. So, what we do here, this is the antibiotic sensitivity testing plate on which the different antibiotic discs are placed on the same plate. In this plate, this is a Mueller-Hinton agar. As we all know, Mueller-Hinton agar is the best media for preparation of antibiotic sensitivity testing. So, antibiotic sensitivity testing is done on this plate, and we place the different antibiotics on the plate. See, we have many antibiotics here. So we will do the lawn culture, carpet culture, which is also called the carpet culture, by the help of a swab stick. So we do the lawn culture and place the different antibiotic discs on the plate and incubate it overnight, or 18 to 24 hours is the incubation period. After 18 to 24 hours, we will get the result. So, by putting this disc, the highest concentration is near the disc and it diffuses through the media. That is why it is called disc diffusion method. Here, the antibiotic allowed to diffuse through a solid media so that the concentration is highest. Nearer the antibiotic disc, nearer the highest the concentration of the antibiotic, and more the area and less is the antibiotic. This diffusion test needs media, Mueller-Hinton agar plate, sterile swab, antibiotic discs which are 6 ml, a normal saline or peptone water in which we will perform the turbidity standard solution. and Maxwell and opacity standard solution, by which we will do the comparison of the turbidity. So this is the MHA agar plate on which AST is done, and these are the sterile swab sticks by which we do the lawn culture. These are the filter paper discs which are being put on the Mueller-Hinton agar plate for testing AST. This is 0.5 Maxwell turbidity suspension. So this is the control, means this we get already prepared 0.5 Maxwell turbidity for bacteria, and we will match this by inoculating the bacteria into the suspension, and we will compare it by doing the turbidity standard test. What is the procedure? So, inoculum preparation, directly suspending the colony in the normal saline. So, what will we do? How is it done? So, we will take one peptone water or normal saline, and we will do one thing. We will pick up one colony and we will suspend it into the normal saline or any suitable broth, and we will incubate it for 37 degrees Celsius for 2 hours. Now we will adjust it to the 0.5 Maxwell and opacity standard, which is equivalent to approximately 1.5 into 10 raised power colony forming unit per ml of bacteria. Means if we will see the 1 ml of that opacity standard 0.5 Maxwell, so the colonies will be 1.5 into 10 raised power 8. So after the comparison, after the matching, we will do the lawn culture. So lawn culture is, how is it done? It is done by spreading the sterile swab onto the media 3 times. Disc impregnation, how are discs placed? Discs are placed at least 24 mm center to center, not from the periphery to periphery, from center to center at least 24 mm apart on the MHA plate. Maximum we can put only 6 discs on a single plate, that is 100 mm plate. Not more than 6 discs are recommended by CLSI. Incubation, the plates are then incubated at 37 degrees Celsius for 16 to 18 hours, or it can be also done to 24 hours maybe. Susceptibility of the drug, determined by the zone of inhibition of bacterial growth around the discs. As you saw, the MHA plate on which the different discs were placed, there are zone on inhibition, which is measured by vernier caliper. This is the vernier caliper. This is a kind of a scale by which zone of inhibition is measured. How is it measured? It is measured from one periphery to another periphery, one end to another end, not from disc center or disc periphery to the zone of inhibition. No, it is measured from the zone of inhibition of one end to another end. And after we will see, for example, we get in this one we will get the zone size of 24 mm, and in this we will get the zone size of 2 mm. So we will check the chart in which we have already got the CLSI recommended charts for some particular disc for every antibiotic of for every bacteria. So we will see the chart and we will match. If the sensitivity here is more than 24 For example, it's more than 15 and we get 24. Zone of inhibition should be more than 15 and we have here is 24. So we will interpret it as sensitive. And if we here have a zone of sensitivity, zone of inhibition should be more than 12. So we have here only 2 or 4. So this is resistant. This diffusion method is performed like this. Here, this is sensitive. These two drugs are resistant. These are sensitive. This is sensitive and this is resistant drug. This is the bacterial growth in the center, and zone of inhibition is the clear zone around the antibiotic discs. See how it is measured. So here is a short like it's an interpretation chart by which we check, like here it is ampicillin. For ampicillin, for example, E. coli, for sensitive it should be more than 29. So if for example this is Staph aureus and we will see ampicillin has 29, and for example this disc is ampicillin and if it is more than 29, we have measured this zone of inhibition, and if it is more than 29, that it is sensitive, and if it is between 22 to 28, that means it is intermediate, and if it is less than 21, then it is resistant antibiotic. So these are some antibiotics. These are the different zone of inhibition sizes of the different antibiotics for the same bacteria. But you know, there are many different zone of inhibition sizes for many different bacteria. There can be sensitive for ampicillin, for Staph aureus, like for example here it is 29, but for E. coli it may be 22 only. So they are different recommended by CLSI. What is intermediate? So anybody will ask me, what is then intermediate? Intermediate is like it is somewhat able to kill the bacteria, but we should raise the dosage. Okay. So Stokes method is also called as comparative disc diffusion test. In Stokes methods, what will we do? We place the test strain on one side of the plate, and on second side of the plate we place the control strain, and in between there is a gap. The MHA plate is divided into two halves. The test strain and control strain are inoculated separately in each half. Okay. An uninoculated gap of 2 to 3 mm wide should separate the test and control on which the antibiotic discs are applied. See, we can see here the two strains are being lawn cultured on the same plate, but they are divided by 2 to 3 mm gap on which the antibiotic discs are placed. Okay. An uninoculated gap, and then the plates are then incubated at 37 degrees Celsius for 16 to 18 hours. The sensitivity report is prepared by preparing the zone of inhibition of control and test strain. So the report is being done by the comparison of both the zone of inhibition. So here we can see the in the control strain, we can see that it is sensitive for both the drugs, but in test strain it is resistant for both the drugs. As we can see here clearly it is resistant, and here also it is resistant because it is not even matching. Okay. So next is dilution test. Dilution test is used for the dose. It is useful for the dose deciding. So quantity use dilution method for dose decide. This method is used to identify minimum inhibitory concentration MIC, minimum bactericidal concentration MBC of a particular antibiotic for specific bacteria. Means minimum inhibitory concentration is the lowest concentration of antibiotic agent that will inhibit the visible growth of microorganisms after overnight incubation. So there is a difference between the MIC and MBC, and the difference is like in minimum inhibitory concentration, we can decide that there is no visible growth. Means there is no visible growth. There is a difference between the visible growth and the no growth, okay, of bacteria. MBC is the minimum concentration on which the bacteria is being totally killed. So in MIC, we cannot see the growth, but that doesn't mean the bacteria is not present. But it is able to stop its growth. Okay. And in MBC, it is able to kill the bacteria properly. Okay. In this method, we take 10 to 12 test tubes which contain Mueller-Hinton broth. So we take 10 to 12 test tube in which we will take Mueller-Hinton broth. So we will do the serial dilution of the given antibiotic. For example, we will see in many antibiotics, in many of the antibiotics, yes, this diffusion is not recommended. We don't have the availability of the discs for those antibiotics. We do the MIC. So we will do the serial dilution of the given antibiotic, and after that we will add equal suspension of bacterial culture in each test tube. We will incubate at 37 degrees Celsius for 18 to 24 hours. After incubation, we will see the turbidity formation. See, here we have test tubes and we have different concentration of the antibiotics. Antibiotic concentration here is 64 microgram per ml. Here it is 32. Here it is 16. Here it is 8. Here it is 4. Here it is 2. And here it is 1. So when we have inoculated the same amount of bacteria in all the tubes, but at different concentrations, there are different types of turbidities present. Here, turbidity is present in 1, 2 and 4 only. At 1 concentration, 2 concentration, 4 concentration only. But from 8, it is not present. It means at 8 microgram per ml, this antibiotic was able to kill that particular bacteria. Not only, not kill. On 8, this particular antibiotic was able to stop the growth of that bacteria. So 8 is the MIC. And if we will do the subculture, okay, if we will do the subculture, we will see that on 8, here is a growth. On 16, here will be tiny growth. On 32, there will be no growth. And 64 also no growth. So it means here 32 will be the MBC. How? Because it will be able to kill the bacteria on 32 microgram per ml. Okay. In this tube, where turbidity is formed, just next test tube where growth is not appeared is called as MIC tube. At this stage, bacterial growth is stopped. The minimum concentration tube in which turbidity is absent is the MIC value. Detection of MBC. Discard all the tubes in which turbidity is present. MBC is the inhibition concentration of antibiotic in which the growth is absent is the MBC value. Agar dilution method. Serial dilution of antibiotic is prepared on an agar plate. Then many bacterial strains are inoculated at one time and absence of growth indicate MIC value. So here what we do, we prepare an agar plate with different concentration. Like we will prepare an agar plate with 64 microgram of particular antibiotic, and we will prepare another plate in which we will dilute the media with the antibiotic of 32 microgram per ml. So we prepared the agar plate of Mueller-Henton agar with different concentrations of antibiotic. And if we want to see that this whether this bacteria is able to be killed by that particular antibiotic in, for example, 8 MIC, we will directly inoculate onto the plate, and we will see whether its growth is present or not on next day. If it is present, then it means that on 8 it is not able to kill that bacteria. Okay, so we can do this like it is very useful in a research method, because many bacteria can be MBC here only. MBC is determined directly. No MIC is determined because growth is directly killed. The bacteria, the growth is stopped, as well as the bacteria is also killed. So what we do here, here we can put many different bacteria on the same plate. We can test the many bacteria on the same plate at the same time, and we can check the MBC value of for example 20 bacteria on a single plate by checking the MBC of that bacteria on a single plate. Epsilometer or E-test. In this test, filter paper strips which contain different antibiotic concentration gradient is being used. See here, E-test. Epsilometer test. In this test, this strip is infused with different concentration of the antibiotic. See, here the antibiotic concentration starts from 0.016 microgram per ml, and it is increasing by its gradient. So at last its concentration is 256. So the MIC here will be 0.75, because the elliptical formation is seen. Its procedure: make lawn culture of test bacteria on MHA plate. Here, a strip absorbed with known gradient of antibiotic concentration is placed on the plate. Antibiotic diffuses into the medium, and zone of inhibition appears around the strip, which is elliptical shaped, elongated circle stretched into an oval. MIC is recorded as the lowest concentration gradient. So here the MIC is 0.75. See where it is, where the elliptical shape is ended, it is the MIC value. Here the MIC value is 0.75. Okay, so this is all for today. I hope everything is clear. If there are some doubts, you can ask me in the comment section. I will try to answer it as soon as possible. Tomorrow we will meet again for another lecture.